Hello, my name is Lacey Clem, and I'm the Northwest Regional Coordinator from the Indiana State Library's Professional Development Office. Thank you for joining us for today's webinar. We are pleased to have Shannon Tenney, Program Specialist at School Care Team, with us today to give us a session about bookmarking success, partnering with the School Care Team to enhance library impact. I'd like to start off the webinar with a few announcements. To register for our other webinars and trainings available from the Professional Development Office, please see the Indiana Library's events calendar, which can be found on our website at library.in.gov under Services for Libraries. For a full list of our current in-person training menu, please see our continuing education website. If there is a global sound issue during the webinar, we will announce it in the chat box. If you are unable to resolve the sound issue you are experiencing, we are recording the session and you can watch it offline after the meeting has ended. Also, make sure your chat is set to everyone in the chat drop-down menu so we can see your comments and questions. As you have a question, just pop it in the chat because Shannon will be answering as she goes along. Today's webinar will be archived and available on the Indiana State Library's archive trainings page after it has been transcribed. This session is worth 1 LEU, and I will be sending out certificates and a link to this presentation later next week. Without further ado, I will now turn the presentation over to Shannon.
Good morning. Thank you so much for having me. So my name is Shannon Tenney. I'm with the School Care Team. School Care Team is located in Fort Wayne, Indiana, but we do serve the northeast, or the northern tier of the state, as well as the central tier of the state. So we provide services to schools as well as community organizations, and we provide services in the realm of mental health, suicide prevention, and well-being. So we serve 3-year-olds all the way to adults. As old as you'll listen to us, we've got programming for you. I'm going to go through today some of the programming that we offer here at the School Care Team. And like Lacey said, if you have any questions at all, please feel free to drop that in the chat and she'll go ahead and pop those questions my way. We have done a lot of work with the libraries around our area, and we love working with the library. We love working with students. We love working with adults, and we love equipping adults to work more comfortably and more confidently with students. So I'm going to go ahead and show you a little bit about us. Maybe. There we go. So a little about us and what we do. Like I said, we typically work closely with schools, but also community organizations, with youth being our primary focus. We know that youth are impacted by teachers and adults, but also by those in the community that support them. A lot of times that is libraries and library staff as students spend time in the library. We also know that employees and administrators impact parents and teachers, which impact youth. We know that the local community and the state level also impacts all of the aforementioned. So our primary focus is youth, but we also know that those serving youth and those impacting youth are very, very important, and their well-being matters as well. So student well-being is the top of our list, but adult well-being as well is very important to us. Not just parents, but also adults that are impacting youth or having conversations with youth in any capacity. So the School Care Team, we do a little bit of everything under the realm of mental health. So if there are topics of conversation, or if there are things that you're wanting to learn or know about professional development, we also do that. That is in our scope of work. So one of the things that we as kind of our capstone program, if you will, is our Wellness Recovery Action Planning. So this is a program that we like to take adults through, but we also have a student version. WRAP is for everyone. So with WRAP, the idea is to identify, what do I look like when I'm well? What do I need to do every single day to be well and to stay well? And then if I'm not well, how can I get back to wellness? We talk about a daily maintenance plan, those things that we need to do. We identify those things and we create a WRAP workbook and a WRAP plan so that we can identify those things and lean on those things moving forward so that we can be well. This is very important for your staff. If you are any sort of leader or if you have staff under you, making sure that they know what they need, and that they're able to ask for that and able to advocate for what they need and ask for support when needed is very important. So WRAP takes you through those steps. There are some quotes from participants on these pages as well that you guys can read. WRAP is an evidence-based program, so it has been um, identified by SAMHSA as an evidence-based program. So it has been proven to help lower stress in individuals. Any questions about WRAP?
We're good so far.
Awesome. Increasing hope. This is one of our key programs as well. We know that hope is very important, and hope is kind of a lofty thing that many people don't really know how to identify. So hope is very important, and it's the idea um, that I play a role in how my life turns out. So I play a role in my wellness. I play a role in the way that my life ends up in the direction that it takes. This is something that is very beneficial for teams to take. We do a lot of team building. We do a lot of activities and games. So we never do a sit and get. We do truly enjoy interacting with individuals and training teams and team building as part of our programming as well. Questions about hope? Building Trust is another program that we offer. So this is something that we have done with the City of Fort Wayne, youth serving organizations, building trust within the workplace. Again, trust is very important for any team, for any organization. Make sure that you have trust within your team to reduce misunderstandings, to increase in collaboration and encourage that positive work environment that we're trying to encourage. The more positive the work environment, the more impactful we can be to those that we're serving as they come into our spaces. Managing difficult conversations. We all have difficult conversations that we have to manage in the workplace because we work with people and people are not perfect. So how do we have those difficult conversations and get to a better end together and build our community and build relationships with those around us, even when we need to have difficult conversations? So bridging differences and managing difficult conversations are two different programs that we offer. We touch on burnout a little bit in this training. We touch on burnout a little bit in multiple trainings, and we actually are going to talk a little bit about burnout in a minute because that is typically a very big topic of conversation for organizations, for schools, for parents, managing burnout and identifying what is burnout. And then how do we manage it? How do we lower that feeling of burnout? And how do we continue to enjoy the work that we're doing? So managing difficult conversations, if you have trouble or if you have staff that just needs support or they need tools in order to figure out how to get along, this is a great training for them. Great professional development. Enhancing organizational culture walks right in line with that. So it focuses on cultivating a balance of work life. How do we do that? How do we do that well? How do we enhance our organization's climate and culture? This was a big topic of conversation for the library system that we worked with for the last year, is identifying the difference between climate and culture and how does that impact our staff? How does that impact the patrons as they come in? How do we create an environment where everyone feels welcome and seen and heard, while breaking down some of those traditional library systems that have been in place for many years? So this is a great training. This is a 4-hour training, 4 to 5, that can be broken up into multiple sessions. And most of our trainings are about 90 minutes. We typically like 90 minutes. So like I said, we can do activities and games and make sure that we are giving you multiple different varieties of learning. So we're not just talking at you, but you're actually immersing yourself within the content that's being delivered. But enhancing organizational culture touches on multiple different facets of an organization's culture and the climate. It identifies the difference between the two and then gives practical tools and solutions to build that climate and build that culture within an organization. We also provide community programming. So we do a little bit of content development on our own. So a lot of our community programs help individuals identify things that are happening within the body. So regulation strategies. We talk about the brain and behavior, ACEs and PACEs, if you're not familiar with that, those adverse childhood experiences that could impact the individuals that are coming into your library or even your staff. How do we increase the positive experiences that people experience and make sure that they are being well and staying well, and how do we provide those opportunities for people to grow and to be healthy? We have trainings on developing wellness. How do we get well? How do we own our well-being? What are the things that we need to do? Boundaries, self-advocacy, really practical trainings for everyday life so that people can be well and stay well and make sure that they're maintaining that state of wellness. Restorative Practices is a program that we did with the Allen County Public Library. So they rolled out restorative practices in 3 pilot sites and then decided to transition it to the entire network of Allen County Public Libraries. The program has been very successful so far. This is a 3 to 5 year implementation program. So it does take time. It takes a lot of intentionality, but some of the feedback that we've heard from participants in the trainings and in the continued implementation is that nothing but good has come from this program, that students are able to self-govern better and more often. Kids are more agreeable to having conversations with adults and to owning their level of responsibility and their onus as they move and operate within the library. Kids are coming to adults now rather than just trying to handle issues or manage things on their own, even big emotions. They're coming to the adults that are in their safe spaces in order to get help as they move through figuring out life and figuring out how to get along with other individuals within the library or outside of the library. They're less adversarial. There's been a lot of situations with teens in our area that have just been kicked out of the library because they're not able to follow the rules, and they can often get adversarial within that process. So teens are being less adversarial in general when they come to the library in Fort Wayne. And then the other thing is that teens are just managing themselves better. So they're using better English, proper words when they come into the library. Even those kids that typically tend to swear a lot or maybe use inappropriate language, they're starting to self-govern and choosing to use different language when they're within the library because they know that the adults that are around them care for them and that they have set those expectations for them. And they've built relationship with those kiddos, and they know that they're going to say something if they choose not to follow those systems that have been put in place. So like I said, restorative practice is a framework. We often call this community building practices as well because we are helping build community. Youth have been the focus for this, but this trickles into staff and into those staff spaces and into the workplace, and then it trickles into the community as well. So as you can see, there are multiple school-based practices on this flyer. I'm just going to move me here so you guys can see. So it's a multi-tiered system of support. So there are 6, they're called school-based practices, but these are practices for any situation and any organization that is implementing restorative practices. So intentional communication, how are we talking to kids? How are we addressing behaviors that we see within the library that maybe we don't want to see or that are not appropriate? How do we be less punitive with our discipline, and how do we be more relational with discipline? And that's a really hard concept for people. It's a really hard practice, but it is possible. Moving into community circles, responsive chats, mediation, and then responsive conferences. So like I said, this is a 3 to 5 year implementation. We always start with tier 1 at the bottom, which is intentional communication and community circles. That's a proactive approach to that punitive discipline. So we are trying to get away from that and build more of a community approach. And then tier 2 is the repair. So we're teaching responsive chats and responsive mediation. How do you have conversations with students? How do you have conversations with adults, or maybe even your own staff members or fellow staff members, to have a restorative conversation, to get on the same page and repair harm that may have been done? And then tier 3 is the restore. So again, this is year 3 or later. You're having those restorative circles, you're having those restorative conversations as you're bringing someone back into the community after harm has been done. And this is for very severe incidents. So this is, physical harm, or some sort of assault, something that has harmed the community in a very large way. So this is not for, someone stole someone's pencil or a very minor infraction. You would be managing those things in tier 1 or tier 2 with responsive chats, with circles, or with intentional communication. So this is just a framework. It's a foundation for building community and helping communities build and be more peaceful and be more restorative in general. So this has been a very successful program for the Allen County Public Library. They're in year 1, finishing year 1, moving into year 2. And so far they've seen great response from the students and from other staff. And they're continuing to work to get the rest of their staff trained. But if any of you would like to have a conversation about restorative practices in your own library, I would love to have that conversation. Any questions about any of our programming before we move on?
We don't have any so far.
All right, good deal. I'm either talking too fast or I'm throwing too much at you or just enough. Who knows? All right, we're gonna do, I'm gonna provide just a little snippet of programming that maybe we would offer if we were to come in and do a professional development for some of your staff. So I do have a trivia question, so hopefully we'll get an answer in the chat. Lacey can let me know. So the trivia question I have for you is, what % of adults are burnt out? Just throw out whatever number you think. What % of adults do you think are burnt out?
We have an 85%, 75, 80, 50.
Okay.
So another 75.
Okay.
48.
Okay. I love it. Any other guesses before I give you the answer?
I don't see anything else coming in.
Okay, good deal. So the actual number of individuals that are truly burnt out is 10 to 15% of adults are burnt out. And that number is probably shocking because of those high numbers that you guessed, and that's very normal that we guess those numbers. But it's really truly 10 to 15% are burnt out. And if you look at this graphic on your screen, we have exhaustion, unproductivity, and negativity. And in the middle there, where all 3 of those intersect, that's where burnout occurs. So 10 to 15% of us could be in that quadrant where we are feeling all 3 of those things. But 30% of our staff and 30% of adults are actually fully engaged. Fully engaged. So if we take that number, that takes us to about 45% of people. So 55% of individuals fall within one of the other 3 quadrants, the exhaustion, unproductivity, negativity, or a combination of the 2. So that's good news that we're not all extremely burnt out, but we are feeling other things and experiencing other things from the workplace. So while nearly everyone at some point experiences a heavy workload and deadline pressures, those are not quite the same as burnout. So research has linked burnout to negative physical and mental health outcomes, an increase in turning to unhealthy coping strategies such as drugs and excessive alcohol use, feelings of futility and alienation, undermining relationships, and limiting future professional prospects. A Gallup survey identified the top 5 reasons for burnout as unfair treatment at work, unmanageable workload, lack of role clarity, lack of communication and support from managers, and unreasonable time pressures. So in recent years, psychologists and researchers have developed specific criteria for determining whether someone is experiencing a stressful period at work or actual burnout. The 3 components of burnout that tend to arise in response to chronic job stress are exhaustion, unproductivity or negativity, unproductivity or inefficacy, or negativity, also known as cynicism. So, exhaustion is profound physical, cognitive, and emotional fatigue that undermines a person's ability to work effectively and feel positive towards their work. Cynicism or negativity is an erosion of engagement. It's a way of distancing from work by detaching and focusing on negativity. Unproductivity or inefficacy is another word for feeling incompetent and a lack of feeling productive and effective. These feelings can either be the result of burnout or an activating event that leads to burnout. So, burnout is a progressive experience. To determine whether you're actually experiencing burnout, you can ask yourself these questions on the screen. Am I regularly feeling physically and emotionally exhausted? Do I feel a lack of energy? Am I having trouble sleeping and worry excessively? Do I regularly feel edgy, sad, or hopeless? Am I more negative, detached than usual? Do I no longer enjoy the things I used to that bring me joy? Am I less interested in socializing, feeling less connected to people that I once did? Am I more likely to complain than usual? Am I feeling like I no longer contribute anything meaningful? Do I feel unproductive and that my hard work isn't accomplishing anything? So, if you answered yes to every single one of those, you're likely experiencing burnout. If you did not, then you likely just need to figure out what area or quadrant or mixture of the two am I feeling in the moment. So, one way that we can do that, one way that we can kind of dive into how we're actually feeling it is we can figure out what are our healthy work-life indicators. So, what are the things that we are experiencing at work, and does that match what we're experiencing? Does that match those burnout qualifications? I'm actually going to have the 3 handouts that I'm going to go over. I'm going to have those sent to you guys so you can fill this out. So what we typically would want you to do, and you can do this on your own while you're sitting in your comfy spaces, is look at this graphic, and I want you to think about which ones would you color in that reflect how much you agree with the statement. So workload, my workload matches my capacity and I can effectively get work done. So if you would agree with that, you would just color that square in or that triangle. And then control, I have a sense of autonomy, access to resources, and a say in decisions. If you agree with that, you would color that one in. Reward, I feel that extrinsic and intrinsic rewards match my work effort. If you agree, color that one in. Community, I have supportive and trusting relationships with my colleagues. If you agree with that, color that one in. And then fairness, I believe that I receive fair treatment and I am acknowledged for my contributions. If you would agree with that, you can color that triangle. And values, my personal and professional values match, or at least do not conflict with my employers. If that would be true of you, you can color that one in. So as you would take an inventory of all of these different triangles, the next piece of this would be to look at your work-life indicator strategies. So what strategies do you need to put into place in order to grow in each of these quadrants, which are directly related to those burnout qualifications earlier? So for workload, plan and prioritize your workload, delegate tasks and say no, let go of perfectionism. This can be really hard for us, especially working professionals. It's hard to advocate for ourselves. And during a training on burnout or any sort of work-life balance, we would talk about self-advocacy and advocating for ourselves and give you tangible tools and strategies to advocate for yourself. Give you some sentence frameworks that you can utilize in order to have those maybe uncomfortable or awkward conversations with individuals as you're trying to advocate for yourself. Control, establishing clear boundaries, request access to resources, and avoid responding to work messages at home. That can be a really hard one for a lot of us too. I'm not sure about in your organization or the way that things operate in the library, but a lot of times working professionals work from home or they answer work messages from home, and oftentimes that increases that feeling of burnout. Reward, determine what you would need in order to be adequately compensated and communicate those expectations. Community, ask colleagues about themselves and actively listen. Communicate issues respectfully, express appreciation. Fairness, speak up about perceived injustices or preferential treatment. Request credit when appropriate. And then values, request information about how decisions are made. Express that you would like to be more involved in decision making. So this is just a great, as you would look at your healthy work-life indicators, that first page, and you would look at the ones that you colored in, then you would correlate those to the indicator strategies that you can utilize in order to grow in each of those things to help with that burnout. I'm going to go ahead and go back to this little green box up here, the top causes of burnout. So if we look at those in comparison to the triangles that we colored in for those healthy work-life indicators, if those don't match, then we have some work to do to figure out how we can get on the same page with those two things. But if they do match, then those are areas that we can work on and that we can improve in. And we can look at the strategies for each one of those triangles or those quadrants, and we can really start to use practical implementation in order to grow in each one of those areas to help lower or decrease that feeling of burnout. Any questions on burnout or any of these resources?
Nothing so far.
All right, good deal. Do I have any questions about anything that I've covered? Or Lacey, do you have any questions or anything that you want me to expand on?
I don't have any in the chat and I can't think of any at the moment.
All right. Well, I don't have anything else today other than I will go ahead and share with you that we have resources called the Mental Health Minute. These are YouTube videos. They are 1.5 to 2 minutes long, very short, very engaging, and they are packed full of information on resources for mental health, suicide prevention. We also have Mental Health Minute videos surrounding restorative practices. So if that's something that you were curious about or that you want more information on, I can get you those videos so that you can learn a little bit more about the just the foundational learning of restorative practices and how that might impact the library and the people that you serve in the library. My contact information is on the screen. So if you have any questions at all, feel free to give me a call. Feel free to check out our website, schoolcareteam.org. You can email me s.tenney@schools with an S. It's a little tricky. Schools with an S, care.org. And I'm more than happy to answer any questions. You can follow us on social media. We do post on Instagram, YouTube, Facebook. So if there's any questions that you have about anything that might pop up or any ways that we can support you all in the great work that you're doing, we'd be more than happy to come alongside you.
There is a question in the chat about like what the cost is for your trainings.
Yeah. So we are largely grant funded. So because we are largely grant funded, every area and every organization is going to be different as far as cost. It'll depend on what program you're interested in, transfer your um, and then also how often you're wanting to come in. So have a facilitation model where we provide facilitation, or we can train your staff to provide facilitation to those within your organization or the kids that you serve. So it largely depends on what exactly you're wanting. But any of those questions, if there's a program you're interested in or you just want to get more information about anything that we talked about, please feel free to reach out and we can get you a quote.
And so just so everybody does know that you will be providing like those worksheets. I will be sending those in the follow-up email. And then those videos that you're talking about, are those things that can be found on your
Those are
website?
free. Yep, those are free source. So you can get to them from our website. There's a spot where you can look for the Mental Health Minute on our website, or you can just go to YouTube and search School Care Team, go to videos, and all those videos are posted there. And you can utilize those with your staff. You can utilize those with any youth that you serve. They're really great learnings. And then if there's a video that you see and you want more information about the topic of conversation or more training on that, just feel free to reach out. That's another great way to kind of dive into our content and dive into some of the things that we offer is by looking at those mental health minute videos.
I guess another question for you is will you do you serve like all of Indiana or is it mostly just in your area?
Yes. So we serve all of Indiana, anything under the central tier. And central tier has been, I don't know if you guys, you probably have no idea what I'm talking about when I say that. So I'm sorry that I'm talking in school language. So the Division of Mental Health and Addiction has divided the state into three different tiers. So the northern tier, the central tier, and the southern tier. Typically, if you're in the southern tier, that would be a fee for service. So we don't have grant funding. Well, sometimes we have grant funding. Again, it all depends on the situation, but we are largely grant funded. So typically, there are ways that we can utilize matching funds or we can utilize grant funds in order to lower the cost of training. So we will come anywhere, even outside of Indiana. We've done trainings all over. We go to conferences, we do professional development at staff days for libraries or any sort of training that would be needed across the country. So we'll travel anywhere. We love to travel. We love to go new places and meet new people. But grant coverage is Indiana because of the Division of Mental Health and Addiction. So if you're curious about training and costs, just reach out and we can figure something out.
Well, thank you so much for letting us know everything that school care team does and how it can benefit the libraries. I really appreciate that your time and able to do this for us today. If there are any other questions, please go ahead and put those in the chat. And if not, we'll probably just end it a little bit early, but there's a lot of great information. Sometimes it takes time to kind of let it sink in.
Process. I know. I always feel like I'm shooting people with a fire hose, and I apologize. Feel free to follow up with any questions or any concerns, anything. I'm more than happy to answer emails or phone calls. I'm usually available.
I will be sending out LEUs in the follow-up email, so you don't have to worry about trying to create your own. You probably won't get that till next week. So, because I'm doing LEUs from yesterday's webinar as well, so it'll come sometime next week. We have a lot of thank yous, great information. So lots of thank yous.
My pleasure. Thank you for having me. It's been fun. And again, if you have any questions or if we can be of support in any way to you, your staff, or the students that you serve, please feel free to reach out.
Doesn't look like anybody else has any other questions. Just
All
a
right.
lot of thank yous for this today. So we'll go ahead and um, I guess say goodbye.
All right. Get you out of here a little early. Wonderful. Well, thank you. I appreciate your time and thanks for having me on.
Thank you.